in 2011, Dirk invited me to Mainz and suggested I go and talk to Igor. And I went to see him, and he presented individualized cancer therapy to me, his vision. I thought, that's the future of cancer treatment.
Was it mRNA already?
It was.
It was, yeah.
It was. When you negotiate a deal, you really need to understand all of the elements. Otherwise, how can you be effective at negotiating? The reason why BioNTech in-licensed those programs was good science. China does have good biotechnology companies, really outstanding. It's a global business, and we saw assets there that we wanted to license.
Bienvenue to a new episode. I'm your host, Philip, and on this show, I'm interviewing the best Europeans in biotech to help you grow. BioNTech has helped defeat the COVID pandemic. One of the persons instrumental behind BioNTech's success is its CBO and CCO, Sean Marett. I first met Sean in 2015 in Berlin, when BioNTech didn't have a website, but was already the largest private biotech in Europe. Now, Sean has retired after 12 years at BioNTech, so I went to Hamburg to catch up with him. We talked about the secrets behind BioNTech's success. We also talked about the art of deal making and working with China. So here's my conversation with Sean, and please hit the like and follow button if you're enjoying it. Welcome to the show, Sean.
Thank you very much for it.
Lovely.
Yeah.
Lovely.
Sunny day.
Sunny day, lovely place. Great day worked out. I'm super excited to do that conversation. It's great. I want to start with your, let's say, post BioNTech days. You just retired, was 12 years as CBO, as Chief Commercial Officer, and you told me there's no dog walking.
No, that's right.
How is it working? How is it going?
Yeah, it's been quite busy actually the last few months. The nice thing is I can work on things I really, really want to work on, really like working on, which reminds me a bit of BioNTech actually, because that in the early days that was very much how we built the company, focusing on what we liked and what we were good at.
Yeah, that's cool. And so I saw you're already on the board of iCurious.
That's right.
And then you're also, I guess, looking for maybe other board memberships or some consulting.
That's right. I mean, I've been on board of iCurious since 2021, and I've done a number of board positions over the years. I mean, iCurious is my third one, and you know, I'm interested in doing more board positions.
That's good. There's some investors or some people listening can reach out to you. What I loved is how you transition out. I really loved. I mean, I saw the press release was very positive. I saw the whole there was the post, everything. The tone was like a very nice, positive, planned transition. I think I'm correct about this now.
That's right. Yeah, I mean, we've been planning this for 2 years, and it's important. I mean, one of the things you learn is every so often you need to refresh a board, and I'm of the firm belief that there are people who can do what I did better than I can. Therefore, I thought this will be my last few years, and agreed that with the supervisory board, agreed that with the management board, and so we put a plan in place to replace me.
Must have been a very tough decision, also emotional decision.
It is. But you know. One thing I've learned, you look at politicians, you look at footballers, and sometimes they stay too long and they become less productive. And yeah, and I didn't want to get into that position where you get too comfortable, because success for me was always, you always have to be slightly unsure about the future and slightly nervous the whole time. And I'd lost that a little bit, I felt, and I wanted to get that back. And I think the company benefits from when you really are a little bit nervous about things.
Yeah, that sounds very good. Maybe to jump to a bit different angle, I'm curious to hear the beginnings, maybe BioNTech, maybe even before. Like what I read in your post was that you actually started at Pfizer. Your first job.
Yeah, I left the lab and went into selling for Pfizer. I went to see physicians.
And ended up basically partnering with Pfizer and solving the pandemic together, which is crazy. Like,
Yeah, it was full circle. It really was.
it's like,
Yeah, and what was interesting for me about that was the commercial processes that I learned when I started at Pfizer haven't changed that much since my very first job, and so I really like the commercial element of working with Pfizer and the commercial team. It was just like the old days, actually, very old days.
it's amazing. And I guess when at BioNTech, it helped a lot also. I mean, it must be very difficult in this time pressure at that scale also to negotiate and to get the commercial rights, which I think BioNTech did very well. Must have helped a lot, I guess.
Yeah. So I mean, you need to when you negotiate a deal, you really need to understand all of the elements. Otherwise, how can you be effective at negotiating? And if I didn't understand something, I would certainly learn it. For me, the commercial part was easy in that I knew it. I was at Pfizer, I was at GSK in the United States in commercial roles, so I kind of, that wasn't so difficult. And the manufacturing was also relatively straightforward for me because I'd run plants before in my career, so I understood GMP and clinical development, and also because of my time at GSK in global marketing, where you of course interact with the global clinical group, global regulatory group, and so you really have to understand all of this.
It's amazing how every pieces fit together.
They really is, and you need to fit them together. It's a jigsaw puzzle, and you need to understand that when you're negotiating, because there's you and perhaps one or two colleagues, and then you have opposite you a whole organization with all of the specialization, and they're all asking for very specific things of their business development group. So you have to be able to really argue if you want to be successful as a biotechnology company.
Yeah. I think I will come back to that. I remember we had a discussion once at Bio, I think, about the Genentech deal. You just signed it.
Oh gosh, yes, it was a lot. It was 8 years ago.
But I still remember it. You mentioned something like an 8 or 10 hour call straight or something. But I want to jump after that to that, and maybe before where we stay on kind of career. I'm curious to hear how did you meet Ugo, and how did it come to be, this work at BioNTech?
I met Ugo in 2003 when I was at Evotec, and he just, together with Özlem, had founded Ganymed, and there was also a COO there, Dirk Sebastian, and I remained in contact with Dirk and Özlem over the years. And in 2011, Dirk invited me to Mainz and suggested I go and talk to Ugo, who was in the university at the time. And I went to see him, and he presented individualized cancer therapy to me, his vision. And I thought, that's the future of cancer treatment.
Was it mRNA already? No.
It was.
It was, yeah.
It was. It was sequencing algorithmic selection of neoantigens and manufacturing with mRNA just in time, just for the patient. 2011.
Yeah, but I can imagine 2011 also was still a pretty small organization for you, I guess. I mean, can you go through the decision-making process of, was it really clear or was it easy?
Totally clear for me.
Okay.
Completely clear. You need good science. You need a executionable plan. And Hugo had it. He had it. And I just like Hugo.
It's a personal suffer. Yes. I think from the 20 plus episodes, and like it came up a lot that the personal fit is,
well, it is
very crucial.
It is really crucial because as everyone knows in the biotech, I mean, it is a brutal business. It's not. I mean, it's tough, and you go through ups and downs, and you need to support each other. As a board, you need to support each other in the difficult times and celebrate in the good times, and therefore, fit is one of the critical success factors in my view, as well as, of course, just taking risk and being entrepreneurial.
It makes me think about Stefan Bossel from Moderna, and he said, I met him in Boston once, but he said, biotech is people. Like real estate is for location. And I think that's echoes what you just said.
I think that's correct. I mean, you need good science as well. You need really, really good science.
That's it. And yeah, I remember. I don't know if you remember when the first time we met. I think was in Berlin at the mRNA conference. So what's CureVac, Moderna, BioNTech. And I remember because I had never heard of BioNTech at that time. I think it was 2015, 2016, something.
2015.
And then we met, and you told, yeah, it's the largest private biotech in Europe. I'm like, okay, well, never heard of it. I think your website was not existing or like very, very minimal.
Yeah, it didn't exist until 2014. It was 6 years after we founded the company, after the company started.
Can you talk a bit about these like early days, so from you joined Zogo to that moment, like what's, yeah, why you didn't have a website before? Why, like what's?
Well, I think I think we felt that it was important to focus on building the platforms, and fortunately through Thomas and Andreas Strongman, we had the investment that allowed us to do that. And it takes years to really develop platforms, and so we were able to focus on doing that. And when we were getting closer to clinical stage, we felt that if we want to be a global biotech, and we always said from the very, very beginning, that's what we want. That's what we want the company to be. You need reach, and in order to get reach, you need
The website.
Well, no, you need pharma partners, and so we switched on the website, started looking for partners. That's what we did.
It's amazing. And I'm wondering also but even from HR for hiring, I mean, a website and whatever is pretty useful as well. Like,
well, I'm one business development person who the company will remain nameless, said to me when I said, 240 people and based in Mainz, and he said, but you can't be a serious biotech, you don't have a website. actually, we had a lot of publications, scientific publications, supporting what the company was doing, and the correct answer would have probably been, but I do recognise you have a lot of scientific papers.
It's amazing. I think it's quite extreme sign of prioritization and focus, but I guess it worked out at the end.
Well, I mean, when we decided to partner, because of the quality of the science, we were able to do 5 deals in 18 months on different platforms,
the GenTech deal,
including the Genentech,
which was was it 300 million upfront or something?
Yeah, 325. Yeah, so we raised then just under $500 million in financing from upfront, which was useful for us. Plus, of course, we got some good partners who had clinical operations globally, which of course is one of the things we were searching for in order to funnel our inventions.
Yeah, that's mint. And one still on that similar topic, one thing that is amazing that you build the company in Mainz, which is there is a lot of pharma around, but it's not the biggest biotech hub in Germany or in Europe.
Well, so people in Mainz tell me it's quite biotech because there's a lot of wine in bio, which is a biotech process.
Fermentation.
Yeah, that's right.
But how was it? I mean, can you talk a bit about it? How was it to build the business there? What are some of the challenges? Maybe some opportunities as well. Sometimes when you're a big fish in a small pond, it's better. Or, I don't know.
I think we had the advantage that Hugo, being a professor, had good connections with the university, and so we were able to hire scientists, but also partner with, in particular, Translational Research Institute, which is a Rheinland-Pfalz partly owned institute, and they did a lot with us together, and in that way, although we were 240 people at the time, we were much more than that because we were able to work with the Institute and they provided a further 70, 80 scientists.
Yeah. Reminds me a bit of and I had Harpreet from Ematics on the show and Ingmar from CureVac, and also this very local Tübingen connection with the university, was using the offices there, very heavy support that maybe you get less if you're in a bigger biotech hub or and even
there's more competition for the facilities. I mean, Mainz in the early days when we were sequencing patients' tumors, we were accessing Mainz computing system because it was one of the most powerful systems in Europe.
Really?
Yeah, and that's, I mean, in the early days, of course, there's an awful lot of data to churn through, and you need strong computing power, which didn't really exist in Europe. Mainz was an exception.
Wow. Okay.
Yeah.
But I guess this connected backward, not forward. You didn't, or was not planned forwards by Hugo or someone. But or how intentional was it?
What do you mean for that?
No, I mean, did Hugo already kind of had that plan and knew that there was this infrastructure and access to it, or was it more that he was professor there, and then when you were going forward, you found the right opportunities and the right infrastructure?
I think,
and everything connected.
I think that both. There's always a bit of.
Okay. Maybe the last on the history as well. One thing that always like fascinated me was that you seem to have a very clear delegation and clear set of responsibilities and focus within BioNTech, where you were really in charge, at least how I perceived it, of the biotech business. You would take care of all the bio partnering conferences and the partnering in general, and I guess a big part of kind of investor meetings as well. Versus Ugo could then focus on the rest. And I've never seen Ugo, I think, at a biotech conference or something. And I found it always like first a bit surprising. Usually CEOs will attend some of these meetings as well, but in your case, but it seemed to also work. And probably, yeah, I don't know. Can you talk about? Is it correct? My assumption, or like?
It's correct. Yeah, I mean that's how we worked, and I think in order for that to work, there has to be a good understanding of each other's capabilities and trust, and it's something that we talked about fit at the beginning, and I think it's in some ways it's a little bit unspoken. You just go and do stuff because it needs being done, and that's how we divided up the work. Hugo was always focused on the science there, always, and it was important because what people sometimes forget is that we're never alone in the world, and there's always competition, and you need to be quick.
Yeah.
You need to be quick in biotech.
Yeah. But and how was it when you negotiated deals and they didn't see Ugo or something? Was it surprising to them, or like was it?
I got used to it. Everyone very used to it. Investors got used to it. Yeah, the investor. But at the end of the day, everyone is interested in output. And in this way, we could focus on output. I mean, when we went to do the IPO, we had a number of Nature papers supporting the platforms. These help. If a CEO such as Hugo is spending time at BioEurope, he can't be writing those Nature papers. And at the end of the day, it is, we are selling science.
Science and I guess commercialization of science, and having Aslim as well must help.
Yeah, again later on, that helped too. That really helped too.
It's really nice also how the credit, how they shared the credit as well, Aslim and Ugo, and I'm just
and Aslim. Yeah, no, it's correct. I think it's correct.
It was like nice to see. Maybe one more more controversial question about BioNTech, and I don't know how much you can talk about this, but one thing that puzzles me a bit from this pandemic first, it's amazing. Like what you achieved is like no question about it is insane. But one thing that puzzled me a bit was the amount charge / the margin, and Moderna did basically the same as you guys, I think at least. But then when I saw AstraZeneca, they did more the approach. Maybe they were forced by the university as well, or by public money, and they basically sold almost at cost or with a pretty low margin. And when it's kind of public needs, I found it. I just was two different approaches, but I'm wondering Because I mean, I saw like everyone, oh, we want to solve that, and even I remember Ugo was having like they were signed a deal with Moderna for like fair development or something, and then when you see the prices and now the profit, I mean, it's amazing for BioNTech and for Moderna to have so much cash to be developing. But I'm wondering from a public perception or from whatever thing, how the decision was made, how like what was behind. I don't know how much you can talk about this and how much it's true. Wondering.
Well, I think, if you're a big pharma company, you're in a different position than a biotech such as us who'd just done an IPO in terms of the capital you have and the risk you can take. With respect to BioNTech, we took a risk, we took a large risk in that we focused the company 4 months after our IPO, which was a IPO focused on cancer.
Especially you were a cancer company.
Correct.
Yeah.
On COVID. And we used the proceeds of COVID for the original vision of the cancer research. So the money flows back into further research. I think that had we been unsuccessful, it would not have been terminal for BioNTech, but it would have been a more difficult time for sure.
Mm.
And, we just didn't know. We had, when we got the results of the clinical phase 3, which was late on a Sunday night in November, we had 2 press releases ready. 1, it worked. 2, it did not work. And you just didn't know. And I think you have to recognize that all biotechs in this business and take risk. You do have to cover that risk.
Yeah. But it's always makes sense. But you think AstraZeneca, they took less risk on the...
No, I don't think so. I think they just had more cushion. I mean, it wasn't, they had many programs. They were cash flow positive. If it didn't work, it wouldn't have been as difficult as for a company that generates no cash, burns cash, and has a limited supply of cash.
Yeah. No, I mean, it's fair. And I think you, at the end of the day also, I think from a margin, or you didn't charge more than, let's say, industry standard for a successful therapy, whatever a rare disease or what argenx is charging or whatever. I think was in a similar ballpark.
I think that the prices are market prices, and that's what we agreed. And I think there, as with all negotiations, there are certain checks and balances, including on the price.
That's good. Maybe so going to what we discussed, let's say the art of deal making, and what we talked at Genentech, to go back to that, the deal you had with Genentech. I want to spend a bit more time on there, and also, I mean, I think in Europe, I think you're one of the best deal makers in Europe, at least for the biotech side, not for the pharma side. At least I cannot think about, too many other that are at your level. So I want to spend a bit of time on there, on like what are some of the lessons, maybe for some people listening who are maybe a bit more junior or senior or more senior. And I don't know, I mean, we can start on many levels, but maybe I was impressed. This what you talked about this our Genentech that you were like, I don't remember how much, like 9 or 10 hours on a call, and you had whatever, like 20 people on the other side of the line with all the experts. So, how do you manage this kind of like discussions and like
Well,
what was the lessons?
and you have to. I think you have to be extremely well prepared, and I think for any negotiation anywhere, you need to prepare. You need to really consider all of the potential scenarios and the way a negotiation can go beforehand. You can't predict it all. There's just no way. But being prepared gives you confidence. And the other thing, I think, you have to know the detail. You really have to know the detail.
How much of that is what you mentioned, experience of commercial, like different set of experience to get there? How much of it is in your control, where you can, let's say, put in more hours to be prepared?
I mean, it really helps if you can understand the complete discovery through commercialization process, because you should just and you know what, you understand a little bit about the market as well. I think that helps. I think too, I've always regarded deal making as a fair balance between two parties. I've seen deal making in companies where people try and get as much as to their advantage as they can. I find that for me, I don't do it like that, because I always regard these deals as the beginning of a long-term relationship, and in any long-term relationship, it's always give and take. And at the end of the day, you're trying to get through a fair and reasonable deal, and sometimes people forget that, and I try and remember that.
You have some examples, maybe you can talk about.
Like, I do have some examples, but I will not be talking about them.
Yeah, or maybe anonymous. I mean, like, I think, yeah, I mean, what, and is it like this also for a fair deal? I think when you're on the biotech side and you don't have too much leverage.
But you got to create your leverage.
Okay, let's talk about that after. But
yeah, you can't. Yeah, you can't. You can't negotiate it with two hands tied behind your back, or, as Winston Churchill said, with your head in the mouth of a tiger.
you go on. How do you create your leverage? How did you do it at BioNTech? Good science, I guess.
Good science, knowing and being prepared to say no, and creating a competitive environment. It's always more than one.
Look.
Yeah, in fact, I negotiated with 3 parties in parallel before. And it's useful to do that.
Yeah.
Because that strengthens your leverage.
Yeah. It's funny because in pharma and biotech, I always feel like competition is a bit, it's not taboo, but it's like, oh no, we are all like not really competitor. Like, also the VCs, we're all friends, we know each other. But at the end, when I hear about really how the deal works, how the deal making works versus, deal making or fundraising, the competition and the fear of missing out is very strong, actually. Like, And I don't know how strong as in other industries, but it's very strong. I mean, I guess.
It's very strong.
Yeah.
It's strong, depending on the science, of course. And some of it's fashion. There's waves of interest, normally sparked by a publication in a renowned scientific journal. But yes.
But going back to your fair deal, I mean, I don't remember the name of the company. I think it was an IL-2 company doing IL-2, targeting IL-2 in Boston. And they were acquired by American Merck. And then when it was released, all the SEC statements, you saw that they made an offer for like 3 times less than the final offer, just because 2 other pharma partners came in, and then the bid went like 3x, which if you count the value, then the first offer was clearly not fair or clearly not recognizing the value. And then the value of the competition is 2/3 of the value of the final value.
Well, you've got to ask whether the first offer. I don't know the basis of the offers, but clearly the price was somewhere higher than the initial offer. It's the fair price.
The fair price was, yeah. And how was the deal with Pfizer? I'm also curious, and I don't know how much you can, not share the specific, but must be also, and especially with that like time pressure. I guess the time pressure was on both sides, gave you leverage, but also removed leverage.
Yeah, we did it in 5 weeks from letter of intent.
Yeah.
So we did the letter of intent, and then we did the contract, and it was all done in 4 or 5 weeks.
That's pretty fast.
Yeah, there was a lot of late nights. But you have to do it quickly. It doesn't matter which deal you do. Deal making, part of the success of deal making is speed.
Yeah. Speed and momentum, I guess. Also.
Speed and momentum, and you really, the longer a deal takes, the less likely it'll occur, in my view.
100% of the time.
It's the less likely. You may get there in the end, but certainly the conditions will be different.
Yeah.
I
like that. I think also my experience with I think it's similar to fundraising as well, where momentum matters.
It does
a lot.
It's the same. It's the same thing, and it's competition. Yeah, also in financing.
Yeah, I like that. I think what's tricky is when you as we discussed a bit also before starting the recording, like when you're a biotech that is not that well financed, or that doesn't have that strong science, or you have less optionality, then how do you like to create this momentum and have this leverage? I think quite a few biotechs in Europe are in that position, especially right now where the cash is start to dry up.
It's harder.
Yeah. And I guess there's no magic trick thing. He says bringing you in as consultant, maybe.
Yeah, there's it depends. I think it depends on the individual cases, and I don't think you can necessarily draw any conclusions, because some may need some marketing, others may need to do additional studies, and then they're there. It depends.
Same as with fundraising, I guess. It's
the same.
It depends a lot on the stage and everything. Do you have, maybe not talking this, or is there a deal outside BioNTech that you particularly enjoy, or particularly liked how it was done, or how?
Well, I did do supply deals for the COVID, and I kind of like that.
Yeah,
because that was different. I was dealing with governments.
Yeah,
and they're different.
How so?
So governments no, they tend to have, of course, pharma has many stakeholders. The government has politicians who may not really fully understand some of the technical aspects of what they're buying, whereas a CEO of a pharma company does. And I think that managing that and explaining that to politicians does take time. And you do have to communicate a lot, because again, it's not always their particular area, and you need to educate them.
You said it takes time, but when you didn't have the time,
or you just make it at the later night.
Okay.
It's but the German government, I mean, we were on the phone late at night quite regularly. Yeah.
That's crazy. Reminds me, I think I saw one interview from Özlem, and maybe she was together with Ugo, was saying the 12 months basically from starting the vaccine, I guess, whatever, January or February of the pandemic.
End of January, yeah. They're in the clinic in April.
And then to injecting the first market access, market approval, and injecting first patient was she said was a crazy ride from a series of sprints, and I think she said she couldn't believe they would be able to do it even from a human capacity, and that was and sounds like exactly what I mean. It sounds like it was a crazy ride. Yeah,
it was. Yeah, it was. And of course, you don't really realize at the time because you're so focused on execution.
It's great. I was thinking about a deal, maybe also a deal that you haven't done necessarily, a deal that you have seen in the industry, observed. Maybe if there's one that particularly stood out, especially you from with a European angle, I don't know, European pharma or European biotech.
That's occurred, you mean? A deal that's occurred?
Yeah.
I can't think of any. All deals are unique. That's the nice thing about biotech. They're all different. I think with BioNTech, if I think about all of the deals that I've done, I found them all fascinating. Every single one of them, whether it's fundraising or Series A, Series B, and doing the IPO, or whether it's
actually the IPO behind.
Well, that was a lifelong ambition for me.
You look very happy on the picture.
I was. It was. I wanted. I told Ugo that day. I said that I've achieved my lifetime ambition.
Let's check my flag.
No, doing IPO on the NASDAQ. I always wanted to do it. It was really cool. Whether it's that or the COVID supply agreements with the government, or we did a deal when I was at BioNTech with the UK with the health system there, which was also unique, or just the deals we did with pharma. They all have their challenges. They're all absolutely intellectually fascinating. So I don't think you can ever say, "Oh, I wish I'd done that deal." I think yes. I think they're just very individual.
It sounds like you really enjoy deal making as well.
Hey, I do.
I think that's a crucial. I mean, you didn't mention this, but I think it's also a crucial.
Of course, you have to love what you do. You have to love what you do. and it's over the course of BioNTech, I don't think with the commitments that we all made, you could commit like that if you didn't love it. You can't do it. I mean, but I was working Christmas, New Year. Didn't really take a holiday for many years, because there was always something, always.
That's good. Maybe we talked about what was important to have, or what's the positive, but can you talk a bit about mistakes you see people doing in deal making, or the common, let's say, common mistakes?
Underpricing.
Underpricing.
Yeah. I think I learned that from my time living in the United States. You have to value good science. And I think that's one thing. But then, on the other hand, if the science isn't good, then that statement is, of course, not correct. And again, it's very depends on the particular situation. And I think realism. I think you have to be practical. Sometimes you have to do things in the short term for the long term. And the IPO was a good example of that. We IPO'd when the NBI, the Nasdaq Biotech Index, was, as they say, falling off a cliff. It was just declining. I think returns for the year at the point we went on the roadshow were 0.5%. And then in October, when we IPO'd, fund managers were losing money. And it was a tough IPO. 1 year.
I remember it was not. I mean, it was done, but it was not the most successful.
And actually, when we were debating it, I remember the advice of one of the bankers who didn't say very much, but he said one thing that I shall never forget. It's just remember, this will set your company up for the long term. And that's how you have to look at it.
That's correct.
Absolutely correct. Absolutely correct. And, that very simple statement, real clarity. And yes, we did it. Not as we wanted it, but it was still a good result.
Yeah, that's it. And going back to underpricing, undervaluing, how do you, let's say, if you have good science, how do you find the right balance?
Because I guess that's, it's,
Especially as a European, we always say we undersell ourselves, versus American tend to maybe oversell themselves as a very general cultural trait.
Yeah. I think Europeans do. I think generally we do. It's a global market. I think that's what you have to remember. And then if you recognize that, then you do look at global comms. I mean, everyone looks at. So there's three ways of doing that. There's a net present value calculation on the assets. There's the comparable deals, which are only as good as what has been done before. I use that a bit, but I don't think I would have done some of the deals had I always done that. And then there's feel. just pure feel. And I think it's a combination of analytics and feel. You have to feel the market, and sometimes that's not so easy, but it does come to you because it's a consequence of ensuring that as a deal maker, you are talking constantly to a lot of companies at some of these partnering events, and then you get a feel.
Mm-hmm. Yeah, makes sense. Yeah. I like that. I think it's, yeah. I guess, I mean, that's the art of deal making as well. There's so much. That's why it can be called kind of art, because there's so much feeling and
It's intangible. The thing is, it's early, so there's a lot in a lot of directions it can go in. And I think you have to look at the science that you are doing a deal on, and thinking about always, at least I always do, the when it goes to the market. Because if you understand that and the opportunity offers, you can get a good sense of value. Sometimes net present value will tell you that, but net present value on preclinical assets, if it's preclinical, it's quite hard. But it's useful to. I still did it. I did do NPVs in my early days. I did them myself to give you another data point. It's data points at the end of the day.
Yeah. And how do you, if, I mean, some people is listening, is because, I mean, that's also the hard part about BD. You want to be strong in science, whatever, PhD, or have a like deep science understanding. You want to have experience in deal making. You want to have a commercial background. Like, that's a lot of like skills, and I guess it's hard to also have all of them. I guess most people in BD will have one aspect where they're stronger, or I think a lot of BD, especially in biotech, they don't necessarily have a commercial experience. So what would you, I mean, advice is a bit word, but what would be your thoughts there? Like, and like, yeah, I guess the ideal profile, or I don't.
I think it's what I said earlier. You need to talk to people. You need to gather information, and you can do that nowadays. Even if you haven't done, let's say, a commercial job, you can still get a sense for the market. You can still read what is the standard of care for a particular program, and you think about how your medicine, if that's what you have in a clinical development, might change that standard of care. You don't need to have commercial experience to do that. And I come back to probably the most important element of any deal making, which is preparation. I used to write my own term sheets. I still do, but term sheets, very detailed term sheets, because by writing your own term sheets, you
understand the details.
You understand the details, but you also get an understanding of much more than that, of the whole strategic negotiation approach. And it helps you in your negotiation strategy. Some people ask lawyers to do it. I don't understand why, because it's a heads of terms, non-binding heads of terms, and but that's just me.
But your lawyer is helping you, I guess, to make sure it's.
I know, not with the term sheet. Contract, yes.
Contract.
But not term sheets. Why? Unless it's a binding term sheet, and then of course you need a lawyer. But if it's non-binding, it's just a list of terms you're going to discuss. But it's more.
What you agree on them.
Yeah, but you need to.
For the audience, maybe on someone not too familiar with term sheets, but it's basically a whatever 1-2 pager with what are the main agreements. I mean, for fundraising or for deal making, at least from I can talk for my fundraising was 1 pager of like, okay, that's will be like the equity kind of equity, the valuation of the company, like the big picture is basically drawn. And then as a second step, you go to contracting. Once everyone is signed, then you go to contracting. Just for if people are not too familiar, but that's okay. So the term sheet, you would do it yourself.
Yeah, I think it's essential in order to be able to negotiate it.
I'm curious on some of the bigger deals you made. How long was the term sheet, or how?
Some. Normally, I try to keep term sheet 3 pages, but one went to 7 or 8. And you got to be a bit careful because you're not negotiating a contract. You're negotiating a set of key terms, which is how much does this cost and what do I get for it? It's as simple as that.
And what does the other person get? Like,
well, no, yeah, for both parties. I mean, it's you have to consider it from both the seller and the buyer end of view.
I like that. I like the advice on the commercial aspect as well. Like, I think it's something I've seen. My wife has works in biopharma as well and has more commercial background and market access.
Oh yeah,
and it's super interesting for me to see all that angle. It helps me to understand biotechs also way more. And now I start reading what the agency is saying about the products to really know, okay, what's the standard of care and what's the added value, at least perceived from a reimbursement point of view. And that's quite key as well. And
it's important.
And that's something I wouldn't necessarily do or do less before. And at the same time, I do also more on the science, but at least I think even for people listening, even if you don't have a PhD, or I mean, if you have enough understanding of the science to allow you to you don't have PhD.
No, I don't know.
If you dig deeper and you can do your work on your own and dig deeper, you can learn a lot. But you have to spend the time and focus and prioritize it. I guess that's also what if you're kind of.
You do.
It goes into what you said, like
you just
preparation means also focusing and prioritizing, doing the work and doing the research and exploring what's needed. Like
that's correct.
Yeah, I like that. Maybe the last spot on the deal making as well. One thing that was quite surprising recently from BioNTech is that you in-licensed a lot of assets from China. Comparatively, I would say, for Biotech, you were one of the only ones really doing that. But for you, from a big pharma, I think you did more than the average. Can you talk about what was the rationales behind? And then the second time, we can talk more about what's your experience was, negotiating with the Chinese culture, which my wife being also Chinese, I'm personally curious about that as well. And I know the culture is very different. The business culture is very different as well. But maybe first the business rationale of licensing there versus Europe or the US.
Yeah. I think the reason why BioNTech in-licensed those programs, which I was, of course, deeply involved with, was good science. And China does have good biotechnology companies, really outstanding biotech. It's a global business, and we saw assets there that we wanted to license. So I think that's why. As to negotiating with Chinese partners, it depends again if they have worked in Europe or the US. That helps, but clearly there's a cultural difference in negotiation. I recognize that. I think you have to. I was quite worried about that, and So I made sure that at least with me, wherever I could, I would have people at BioNTech who were Chinese who could help me translate.
Just the language.
Yeah, not just the language. And China, of course, China is really fascinating. In the one thing I really love about China is it's still a very, very, very strong relationship business, like everything, and that's fun. Building relationships it's great.
I like the aspect you said of. So I think a lot of Chinese biotechs have some history, or at least if I think about Beijing or about what was acquired by Genmab, Pro something, ADC Biotech. They were Seattle and Chinese based, and there's like quite a lot of Chinese. I mean, there's a huge Chinese or Chinese origin population in the US working in biotech or pharma, and a lot of them went back and started with companies in China as well. So I think this, yeah, I can imagine this helps. Like
It
big
does.
times, yeah.
It does.
I think that's great about deal making. I'm curious. One thing I had also industry wise was I don't know how much you can really talk about this or comment, but the whole IP situation on mRNA. I found it like a bit saddening, or I don't know if it's not like a bit sad that it went to that point, especially knowing again when we first met the conference where you were. It was always surprising you were competitors, but quite friendly competition, organizing conferences together, helping each other out. Like, I don't know, what do you think about it? Like,
I think it's an unfortunate side effect of making money. And in certain jurisdictions, it's ordinary course of business. You get used to it. I remember years ago, I met a European who I knew quite well on a flight, and I hadn't seen him for a while. He was a non-executive director of a US company, and the first thing he said to me was, "I'm being sued again." This is a non-executive director of this public company. He said, and the second sentence is, "You get used to it." And it is. It's just
part of the business.
part of the business. As a European, I don't like it. I don't like it at all. As business person, I have to recognize that, in certain jurisdictions, this is just the way it is, and you just have to deal with it.
Mhm. Yeah, I guess especially in the US, it's very legal for communists. The law is very, I don't know the law, but the lawsuits are much more. There's much more lawsuits than in
Ordinary course of business.
it's ordinary. Yeah,
Yeah.
it's crazy. Even you change job, you sue your employer and stuff like. I'm like, what? A friend of mine was just.
I don't think it's that bad, but
Basically changing job, a lawsuit with his neighbor. I was like, what? Like, is that crazy? It's like, no, it's normal. Like, okay. I guess, yeah, I mean, makes sense also for you from a business point of view. I think you said it's a global business and you have to adapt.
you have to adapt.
To
You have
global
to
situation.
adapt. But one thing that I think is important is, and this is where you for me, when all of this happened, I mean, you've really got to believe in your own science and your own patents, and if you do that, they'll react accordingly.
Let's see how it plays out at the end. Maybe a last topic and also from the discussion we had is on you were traveling so much and how you managed and fatigue and the effort. You mentioned passion, that helps, but I think, yeah, what else was there like that helped you a lot? Like you didn't burn out or whatever in 12 years of this rhythm is.
I mean, it goes back to what we discussed earlier. I mean, why do you do this job? It's a love of the job, and I think that brings you a long way, together with the feeling that you're part of a small family, and biotechs are small families. Yeah, most of them are, and of course, and belief. I really strongly believe that, as you've called it, passion, of course, but belief. Because as I said, when I started fundraising, I always tell this story, but it just I never forget it. I went to New York, and it was December, and it was one of the banks had a banking conference there, and when you go to these banking conferences, you get appointments with investors. I had one appointment, and
Only one.
yeah, and that was with a IR agency who wanted to sell their services, and I met at the lunchtime. I met one of the big pharma heads of research and development, who I'd got to know really well, and he said, and he built companies before, and he said to me, "You guys be fine." I'll never forget that, and I thought, oh, okay. And then the next 4 days I spent in New York, actually going around from fund to fund, and I'd made some appointments with them.
Was a growth funds, I guess, for
Some of the
bigger funds.
Big funds, yeah, the big funds. And it was very much, I like to introduce BioNTech, a German immunotherapy cancer company, and they say, who? And that was it. That was always just every single meeting, every single one. But then, we did.
Second time, then there's
Well, I mean, when I think about it, 12 months later, we did the 6th largest Series A ever in biotech at the time. We raised 270 million. So I think it's belief, because it keeps going, and perseverance.
perseverance. Yeah, I think you can hear that from a lot of entrepreneurs, not just in biotech. And perseverance is a key.
Yeah, you have to. Yeah.
That's good. To finish, I finish with quick questions where you can just answer yes, no, or one sentence answer. What's on the top of your mind at the moment?
My holiday next week.
That's a good one. What's your favorite biotech book?
Oh, and The Building of Genentech.
The beginnings of Gen.
Yeah, with the recombinant protein.
That's amazing.
Yeah,
I just reread it.
Yeah, it's great.
2 weeks ago.
Yeah, it's fantastic. Love it.
What's the drug on the market that impressed you the most at the moment, except BioNTech drugs?
I think Humira was one that really impressed me, because that came from behind and became a market leader with in excess of 20 billion of annual revenues.
That's the Luna.
Yeah, I mean, it's remarkable. It's really good. And the other one was Keytruda. That was equally impressive.
Yeah. How much do you sleep per night?
I sleep 7 hours, and I cannot function without good sleep.
That's good. What's the best biotech hub in Europe?
Oh, I don't know. I think,
Mainz.
yeah, I begin to say no. I think each have their specialities.
Yeah. I think Europe as a hub is also good. Not fighting different hubs, but especially compared to Boston, which it's clearly concentrated. In Europe, it's more spread out.
It's more spread out.
Yeah, even, I mean, we didn't mention, but I didn't realize that you were not based in Mainz. You stayed in Hamburg for 12 years and you were commuting.
Yeah.
Which is also an example of how, when you think about the hub, you think Mainz, but actually in Germany, and I interviewed a few others, and it's very common where people commute a lot. I mean, my wife goes to work to Munich from Berlin and goes there once a month, and it works perfectly fine. And you can even do more. And especially Germany, it's so like spread out, also federal, and you have cities a bit everywhere, and it's pretty well connected by train. Well, the train don't run always on time, but it's today they did. But people move quite a lot, and it's not so.
I think the infrastructure in Germany allows you to do that. I'm not
sure. Like if you live in whatever Philadelphia and you go to Boston, it's a bit further, a bit more complicated. Like
it's more difficult. I mean, when I was in Philly working for GSK, I used to go to Carolina every week, and North Carolina, it's more painful. So,
one mistake you made in the past 12 months?
One mistake that I have to think about. I'll come back to you on that one. I honestly, I have to think about that.
You can skip as well.
I don't know. I make a lot of mistakes. So but I can't think of one in the last 12 months, other than not being quick enough to buy a car. Because we don't have a car at the moment.
No. What's one of your favorite European biotechs? Again, except BioNTech.
Oh,
I'm curious.
I don't have one. I mean, I think they're all
not favorite, but one that you particularly like, or maybe one that was remarkable in the last 12 months that impressed you.
Again, I don't really have a particular preference or favorite.
One of your European biotech heroes will be the last question.
One of the what?
European biotech heroes of yours.
Heroes? It has to be, I mean, not European, but it would have to be Art Levinson, who built BioNTech. Because, I mean, he was faced with similar challenges with the technology that BioNTech faced at the beginning with mRNA.
Yeah, and in the book, for those who haven't read the book, I think it's I highly recommend it, and they talk about Art Levinson as well. It's there's a lot of talks about him as well now, a lot of public talks he gave. It's amazing resource. Amazing. Thanks a lot. Amazing discussion.
Thank you for that. Yeah, thank you too. Thanks for coming all this way
to
Hamburg.
I mean, with the weather, everything, it's amazing.
Yeah, it's lovely weather. Lovely autumn day.
I'm impressed by what Sean and the BioNTech team were able to achieve and how they achieved it. I'm also impressed by Sean's experience in deal making and how he remains calm while having this British humor. If you've also enjoyed this episode, please hit the like, follow, review button. Any of these actions will help a lot to give more people access to the show. If you want to see similar videos, please feel free to check out our channel where we have many of those. I would also be curious to hear what you think. So please leave a comment wherever you are or shoot me an email at Philip@Flot.bio. All right. Thanks for watching to the end and see you in the next episode.